Starting right now, millions of Americans are finally seeing more money show up in their Social Security checks, and this change is long overdue. The brand new 2026 Cost of Living Adjustment, or COLA, has been officially confirmed by the Social Security Administration, and it's already reshaping monthly budgets across the country. This isn't just another headline, it's real money being added to your pocket. Beginning with your January 2026 payment cycle, which means deposits could hit accounts as early as late December 2025, your benefit is automatically increasing. But here's what really matters. How much will you actually keep once Medicare premiums, taxes, and deductions are taken out? That's where things get tricky. And that's exactly what we're breaking down today, the real number that lands in your hands, not what the government's press release says. I've spent hours digging through the official SSA statements, the latest inflation reports from the Bureau of Labor Statistics, and Treasury deposit schedules to give you a clear, no-spin explanation. Every figure here comes straight from verified federal data, not rumors or guesses. My goal is simple: to turn this complicated government language into plain English, so you know exactly what this raise means for your family and your wallet. You've probably seen a dozen headlines. One claims a 2% increase, another says 3%. No more confusion. We're cutting through the noise. If you depend on Social Security, SSI, SSDI, or VA benefits, you need to hear this. Because every single dollar matters when you're living on a fixed income. Groceries are still creeping up. A gallon of milk that used to cost $2.50 is now closer to $4. Bread has jumped again, and eggs, back over $3 a dozen. Even prescription copays and rent are climbing faster than COLA can keep up. I hear from so many of you retirees, widows, disabled veterans who say, "I'm just trying to make it through the month without draining my savings." You earned these benefits through decades of work and service, and you deserve to know exactly what's changing with your check. Here's the official headline. The 2026 COLA increase is 2.8%. That's based on inflation data from July through September 2025, measured using the CPIW, the Consumer Price Index for urban wage earners and clerical workers. The SSA announced the figure in mid-October 2025, and the raise officially applies to all payments starting January 2026. This means if you're on SSI, your December 2025 payment could already reflect that higher rate, while retirees and SSDI recipients will notice it in their first January check. And yes, it applies automatically. No forms, no phone calls. Retirees, survivors, widows, disabled workers, and even veterans whose VA compensation is tied to the COLA formula, everyone gets this increase. Let's put this in perspective with real examples. Dorothy, a 72-year-old from Indiana, receives $1,820 each month. A 2.8% raise gives her about $51 extra monthly, adding up to $612 more over the next year. Robert, a disabled veteran in North Carolina, gets $1,500 from combined SSDI and VA disability. His check rises by about $42 a month. That might sound small, but for someone choosing between groceries, gas, and medication, it makes a real difference. Let's break down the national averages. The average retired worker benefit goes from $1,905 to $1,958, a $53 increase. A retired couple receiving $3,200 now gets around $3,290, an extra $90. Average SSI benefits climb from $674 to about $693. And for veterans with a 100% disability rating, the payment rises from $3,137 to about $3,142. However, there's a catch. Medicare Part B premiums are projected to rise again from $174.70 to about $184.50 a month. That's a $10 increase, and for some retirees with smaller benefits, it could eat up part of the COLA. Still, most Americans will see a net positive increase after deductions. Here's how you can estimate your raise. Multiply your current monthly benefit by 1.028. For example, $1,800 JAWS X 1.028 and cause $1,850. Then subtract about $10 for the Medicare increase. Your net gain, roughly $40 more each month. If your income has recently dropped, especially since 2023, and you're paying higher Medicare premiums because of the IRMAA, income-related monthly adjustment amount, You can file Form SSA 44 to ask for a reduction. It's worth doing. Many retirees qualify and don't even realize it. Now, here's the good part. Even though this year's 2.8% is lower than last year's 3.2%, the lower inflation rate means your raise stretches further. Energy prices have cooled, grocery costs are stabilizing, and rent increases have slowed in many regions. So your money should hold its value longer. And remember, this adjustment compounds. That means next year's raise will build on top of this one, not reset. Let's talk truth for a moment. A 2.8% increase helps, but it doesn't erase financial pressure. Prices rarely go back down. Utilities, insurance, and healthcare continue to climb. Many seniors tell me their biggest fear isn't losing benefits. It's being forgotten by a system that moves too slowly. You're not invisible. These programs exist because you fought for them, you funded them, and you deserve every cent. So here's what to do right now. Log into your My Social Security account at ssa.gov My Account. You'll see your new 2026 benefit amount and Medicare deductions. Update your bank and contact info. Direct deposit errors cause most delays. Apply for extra help or Medicare savings programs, QMB, SLMB, or QI. These can reduce or even eliminate your Part B premium. Submit Form W-4V if you'd prefer to have taxes withheld automatically so you're not hit with a surprise bill in April. Call your local SHIP office, that's your State Health Insurance Assistance Program. They offer free guidance on Medicare plans, Part B give-back options, and prescription savings. Even small steps like these can save you hundreds each year. And this is just the start. The SSA will begin tracking inflation again in mid-2026 to set next year's COLA, expected to fall between 2.0% and 2.3%, depending on food and fuel prices. Meanwhile, Medicare is rolling out new initiatives like capping insulin at $35 and expanding dental and vision coverage by 2027. There's also a bill in Congress proposing a shift to the CPIE model, a calculation designed specifically around senior spending patterns like healthcare and housing. If it passes, future COLAs could finally rise faster than basic inflation. So, yes, this year's raise may not feel huge, but remember, every increase builds lifetime value. Over the next decade, these compounded raises can add thousands to your total benefits. You've worked hard for this. These checks aren't charity. They're earned rewards for decades of service and taxes you've already paid. Take pride in that. And take heart knowing that more than 70 million Americans rely on Social Security, SSI, SSDI, and VA benefits just like you. You're part of a powerful community that keeps America strong. If this breakdown helped you understand your 2026 raise, hit like, share it so others get the facts, not rumors, and subscribe to stay ahead of every COLA, Medicare, and Social Security update. And before you go, tell me in the comments, did your check actually increase this month, or did the new deductions cut into it? I read every comment because your stories matter, and your voice deserves to be heard. Helpful links for extra benefits, Medicare savings, and SHIP counseling are all in the pinned comment and video description. Take care of yourself, take care of one another, and I'll see you in the next update where we keep turning government jargon into clear, honest answers that protect your future.